So let's go back over there. Go back over. Yeah. Medical assistant, chapter 1. I'm sorry, I don't know what I was doing. Let's just go back over. Can't do nothing but FBI. 460, Hippocrates is born. He is the father of medication. So the questions would be like, who is the father of medication? Hippocrates. 1701, the first smallpox inoculation was done by Hilarity, the first inoculation. 1816, invention of the stethoscope by Miss Renee Lanique. The stethoscope, remember that? 1849, the first woman to gain a medical degree, Elizabeth Blackwell. 1857, germs are identified by Mr. Louis Pasteur. 1867, Joseph Lister publishes the antiseptic principle. So he discovered the antiseptic surgical methods. So think antiseptic, I think Listerine. Germs is Pasteur. Come on to 1928. Penicillin by Mr. Sir Alexander Fleming. 1945, the development of the first vaccine for influenza. 1950, first cardiac pacemaker. 1952, development of the first vaccine for polio by Jonas Salk. So who invented the vaccine for polio?
Jonas Salk.
In 1953, Francis Crick and James Watson worked on the structure of the DNA molecule. So who worked on the DNA molecule?
Francis Crick and James Watson.
There you go. 1964, development of the first vaccine for measles. 1974, first vaccine for chickenpox. That's when it was invented. They didn't offer it to the public till a little later. Because I was in high school, or past that when they first started giving it to the public. 1980, smallpox is eradicated. It was still around, but now it is eradicated. We should not have anybody with smallpox. 1983, now this is very new history, identification of the HIV. And they'll come around, and that's what we're still battling hard on that one. People are getting HIV left and right. You can't tell anymore. It's not I'm a cheater, I'm a with bisexual, none of that anymore. It's just I'm having sex kind of thing. And I'm so scared for our young people because it's just that. Some folks don't know they have it. They, not that somebody actually meant to give it to them either. And nobody had to go out there and say, give me HIV. So my theory on that, you cannot judge anybody. I seen a little lady, she was never cheated on her husband, nothing. Well, that's what she told me. You never know. But I believed her. And she got HIV just from her husband. And they were actually, agreed on a relationship like that. They had agreed because she just didn't like to have sex. So he went and she didn't like it. But, and he got it. No, he didn't mean to get it. But, that's how it works. I'm just scared for the young folks because they're coming up in there and, people just, they don't use condoms and rubbers and none of that stuff because they're having too many babies. You can't tell me they're using protection. You cannot tell me that they're using protection because they got too many babies coming out. And I tell people that, oh, no. Do you use protection? Yeah. But give them 2 weeks. I think I'm pregnant. Okay, you just told on yourself. I mess them up, and I talk to high school people, girls, and I always give them the theory about, how sperm cells die inside of you and then they have to come out. They take 3 days to come out your body. Your body naturally cleanses itself. And they're like, ew, Miss Cheryl, that's nasty. You got dead sperm coming out. I said, that's right. So don't let them ejaculate in you. Thank you. And they won't be coming out later. So keep yourself fresh, all clean. You'll be good to go. So maybe that's some kind of impact on them. I don't know. But they just, ew. I said, yes, they're in there. You put them in there. They got to come out. Anyway, that's my little theory, and that's why I try to mess them up. Just a little bit. If anything, just keep yourself fresh. Keep yourself smelling good. 1985, sorry. Invention of the artificial kidney, the dialysis machine. And now, do you know how many dialysis machines we got around this place? There's whole companies of dialysis machines. I mean, and y'all might even be able to work in that because you'll be able to be a dialysis tech and stick people as well. In the dialysis. So don't forget that could be part of your journey. They actually will put you in a class though. You're gonna have to go to class because you'll have to learn how to do their machines and do the wash thing they got. But they will hire phlebotomists for that. And then it's just like it's a mandatory class you have to go to. So that's another job opportunity. You can go that way. 2006, development of the vaccine to target the cause of cancer. And that's the one they give most of your teenagers nowadays because they say we've already been exposed. The older you get, you've been exposed already. Whether you got them or not, you've been exposed. HPV? Is that it? But that's going to solve a lot of things that, as far as the cancers and stuff, because they start from a wart. They don't even see. Nobody sees because it's inside. And that cervical cancer stuff, a lot of that has been developed from that. So that's a wonderful thing, and we're getting better. And they've even targeted the DNA molecule that suspects that it's causing breast cancer. So they're getting there. So I don't know if we'll see it in our lifetime, but it's coming. A lot of medical stuff going on right now. No, the definition of a disinfectant. Just write this somewhere in your thing. This is your homework. We might go over it. It's just things that when I went over and seen test questions and stuff that just isn't addressed or big highlights. So know your definition of disinfectant. Know that penicillin kills microorganisms. Just write that in there. And there's a question along the way that asked, does penicillin halt, slow, or kill microorganisms? It kills. Just write this in, any communicable disease, you will wash with hot soapy water and keep separate. Just write it in. We're actually going to tell you that in a minute, but for any disease, infectious disease, you're going to wash the dishes with hot soapy water. I think it's boil them for 20 minutes. Boil for 20 minutes. And we're going to do that one in a minute. I don't know why it's over there. But that is important. I put it over there because it's important. All right?
You said hot soapy water, right?
Hot soapy water. And boil for 20 minutes. All right, law and ethics. A medical assistant is the term for healthcare providers that perform medical as well as administrative tasks to support their health professionals, such as doctors. Doctors are y'all bosses. So is the nurses, but the doctors are the ones who say, in this practice, this is what my CMA is going to be able to do. Because they are actually the ones going to be responsible for saying they can do this, they can do that, they can do that. Your supervisor will be a nurse, but up under that, over there is your the doctor is the one who says and can add things to what you've learned or add things to your duties. So it will be under direction of a physician. But most of the time, underline that as well. A physician decides the appropriate amount of work that you're going to be doing, I guess you would say.
So what's going to underline the first one, or this one is still about?
Both.
Okay.
Yeah, underline. If I say it, it's important, but if I say underline it, it's going to be whatever I say right behind it.
Okay.
But you will not be able to do things such as incisions unless your doctor wants you to. Aspiration of hypodermic fat, local anesthesia, because they are not considered the duties of a medical assistant. So know those things that you will not be able to do or are generally not your jobs. But again, the doctor says in this practice she will do it. They've got to train you. They've got to have somewhere saying that they trained you and certified you to be able to do that. Routine tasks, you will take vital signs, record information, administer medications, prepare medical supplies. And you may be doing sterilization. Depends on where you're working as well. Underline that definition for sterilization. It's the destruction of all living microorganisms by chemical disinfectants or boiling for 20 minutes. That's another sterilization. Just like we do our baby bottles. You know, that first baby you have, I should say. You boil everything, keep everything clean. You give them the best Pampers. Then the second one comes along. I don't know. We don't do half of that. We might boil for a week or so. And we realize, oh, they're gonna be fine. But that's what sterilization is. Boiling those bottles for 20 minutes. And that next sentence there, that's coming back to you, where it says also sterilization of medical equipment or supplies, such as dishes from patients with communicable contagious diseases. So that's how we will treat those. And collection and preparation of fluids and tissues for testing. That's the phlebotomy part of it. That's the urine drug screens. That's the urine analysis that you might have to do as a CMA. Administrative duties may include greeting the patients, medical record keeping, answering telephones, filing insurance forms, scheduling appointments, and or arranging admissions for hospitals or laboratories, and billing. Really depends on what your office is doing. They may have like a receptionist that isn't they've just been trained to answer all the phones, and they may make appointments as well. Or there's a CMA sitting there making all the appointments, and a lot of times there is. That's where the CMAs will go as well, right to the front office, doing the scheduling and doing filing the insurance, getting your insurance card, filing that, putting in all the information in about insurance, and sometimes even talking to the insurance people. It really depends on where you're working at. It always does. So when you get to your job, you're going to be trained there one way. You get to another job, they're going to have a whole new set. Your basics are always the same, vital signs. You may pull blood. You may give injections. You may even pull out staples, pull out stitches. A lot of times they'll be like, oh, she can do that. Because the wound is healed. All y'all need to do is take the stitches out. And they might give you that job as well. Really depends on where you're working at. I keep saying that, but it really does. Medical assistants work under the direct supervision of a physician. They say that again, so that's important. Make sure that it's underlined. And underline this is very important too. You are authorized to give emergency care when a physician's not around. To underline, the medical assistant is allowed to give emergency care in the absence of a physician. If they're having a heart attack, hemorrhage, stroke, shock, you should call for an ambulance if no nurse or doctor is present. And you would do that anyway. You know, even with the doctor there. Maybe not. I'd let the doctor tell me to call. But in the place where I worked at, a doctor was never there. He came in the mornings and did his thing, but all the patients were still there. So when something happened, we called the doctor or called 911 if it was major. Otherwise, we'd just give him a call. Medical assistants may instruct patients about medications. You may administer medications. That's another part of your medical assistant. And you can call in prescriptions to pharmacies. Underline that. You can do that. In the state of Georgia, I don't think it is as well accepted, though. Right now, they're having problems with the physicians calling in the order. So, wherever you work at, make sure you know the laws and the rules to that. Okay. The reason we are having to check those medications, or just underline this. Some medications are dangerous or habit forming and require a prescription in order for a patient to obtain them. You know, you got your over-the-counter drugs where anybody can get, but some you need a prescription for just because they may be habit forming, dangerous. There's something in them that can mess with you, and that's why they're not over-the-counter. Over-the-counter works. Ibuprofen, Advil, Motrin, all of that is wonderful, but that to the general public, that is fine. Blood pressure pills. If I take a blood pressure pill, I don't have blood pressure issues, so that could be dangerous to me, and drop my blood pressure and kill me. So that is why a lot of them are under prescription. So you have to get a prescription. The medical assistant should have basic knowledge of law and ethics of medicine. That's just a basic statement, but you need to know the laws, what you need to do. Ethics is what's right and what's wrong. Sometimes they're questioning. You ever heard of an ethics committee in the hospital? And it's because, you know, say it's a Jehovah's Witness, they will not accept blood from other people. But then you've got this 6-year-old, 7. It'll probably be, I'm going to go with my 11-year-old, because I got an 11-year-old. She's going to make her own decisions. She's going to want to have a say-so in it too. Parents say no blood. Their blood doesn't match, so, you know, they're going to pretty much, they don't have any blood for her. And they didn't donate before, because sometimes they'll donate and keep blood on hand of their own. But none of that. But the 11-year-old says, you know, give me whoever blood. I want to live, you know. They would take that to the ethics committee, because you're supposed to listen to the parents, children, the child is underage, and their religion. You know, they got to make a committee about that. And be careful, because parents could sue. All the above. Pretty much, but the child, I would go with the child. I'm going to save the child, 11-year-old child. But you would have to be that emaciation from their parents or whatever, which is crazy. You know, I haven't chosen 11 years old. I haven't chosen. I probably do say I'm a Jehovah's Witness at that time, because I'm going with my parents. But you know, you're not grown. But I want some blood. If that's going to save my life, please give me some blood. Parents say, no, we don't accept blood. They believe blood is the soul of the person. Just like, you know, the blood of Christ is the soul. That's the blood of Christ. So blood of yourself, same. So they don't believe in sharing that at all. So those are your ethical things. Things happen like that, and you're going to have to make a decision, and doctor's going to have to make a decision, and they will push that. That's an ethical decision. However, you'll be interacting all day, doing all kinds of stuff, but you should not discuss a patient's complaint with them or give a prognosis. Underline that. You shouldn't discuss the complaint with them. You are to ask them what their complaints are for the day. Because, that's part of your charting. That's part of you introducing that patient, getting that patient ready for the doctor to come see them. You're going to ask them, what's wrong, what's going on, but you don't discuss it. You don't offer your opinions or advice or, well, this is what I did when I had that problem. None of that. Because they're going to say, well, so-and-so told me to do this. You don't do that because you are connected to the doctor, so they would assume that you're telling them something correct. So don't do that. Also, you can't give prognosis, and underline the definition of prognosis. It's the opinion to the probable cause and outcome of a disease. It is the opinion to the probable cause and outcome of a disease. Whereas a diagnosis is the cause. Prognosis is different. And most of the time they give you a prognosis on the life to live. You got 6 months to live. You have 3 months to live. That's your probable outcome. You're not going to give advice because patients tend to take the medical assistant advice and opinion as those of the physician. So you're connected to that physician, and they say, well, she said I'd be okay. And you telling me I'm done. But she said I'd be okay. So be careful when and you don't hear it a lot, and you just got to know that they're not going to tell you, oh, you'll be okay, it's be all right. You're not going to hear that so much in a doctor's office in case somebody just ain't thinking. Because it might not be okay, and it might be the worst thing you're about to go through. They're not going to say that. You got to find some new words when it comes to that. Because I know everybody, it's going to be okay. You got it. You got it is a good one. It's going to be okay. They try to pull that out your vocabulary when you're talking to patients. Because it might not. It might be that they're dying in 3 months. Pray God. Somehow you can still give encouragement without giving false hope, and that's what you got to do. Also, being neat. You got to be neat, organized, especially if the working place is in view of the patients and free of clutter. Underline free of clutter. Somewhere along the line, they're going to ask you a question about, as your desk needs to be free of clutter. I think it's an ABCD question. I've seen it along the way, so just know that that's coming back to you. It's an odd question, not so important, but it's important. Keep a neat desk. I always keep saying you're going to step up. You're not a CNA, you're not a medical assistant, you're not none of those stepping stones, I call them. You're coming up. You need to look the part, act the part, talk the part. All that being on the phone, all that trying to call out for work, nope. All that and the above, because people are waiting on your job. And then when they see that we can't, because CMAs are actually like a backbone. You are the go-between. And when they see that you're not working well, they will find another one. Because you've got to communicate with the staff. You've got to communicate with the doctor. Even if you don't like them, you pretend you like them. And that's your job. And as long as they're not mistreating you, that's up to you to like who you want to like. But a job is a job. And hopefully you can still like your job and not like the person you're working under, or anything like that. Just be that person, because now you are the face of that doctor's office, of the surgery center, of whatever. It's somebody that sees you first. So, and I tell my baby that too. She's a CMA looking for a job. But I said, you just can't just throw yourself together. Don't go out there looking for a job and you wrinkled up, and because she's a CNA, and I don't mean nothing by it, but as a CNA, you can go to work like that. Because you're going to work and you're going to look like that later regardless, whether you came in looking like that or not, because you're going to work. And you're going to look like you worked. So I said, but as a CMA, you're still working, you're organizing, you're doing things. It's just not as much manual. The same as you keep going up and up. Same thing. Floor nurses, they look a little more rougher than the little nurse sitting at the desk. It's because we know we're coming into work. We're not as neat and put together because we're going to be looking like the CNA later if we're doing the right thing. We've been working. But it goes like that. This CMA, you're going to be in and out of it is. Sometimes you're going to be sitting down, sometimes you're going to be doing the actual, working behind the scenes, giving administrations, taking urine. It really depends on your job, but that look, be that look. When you're going for your interview, be that look. Put your little jacket and little white coat on. Get a little name tag with your name tag on it, CMA. Look the part, and that professionalism. It's got to be you got to upgrade when you're coming up. And I'm not saying that for anybody else. I'm just saying upgrade a little bit. Just like me, I'm the floor nurse. I don't want to do management. I've done management. I don't like it. I really don't. Because you've got this management coming down on you like you can control somebody. I can't control people. I'm not going to control them. They either going to work good or not. Then we'll know. Anyway, I'm the floor type person. You can tell me what to do and I'll do it. I got you. Anywhere else, management is my thing, but I don't like it. That's crazy and backwards, but that's my two things I do. But just know, look that part. I don't know where I was. Oh, being neat and organized, especially in administrative working place and the view for patients and free of clutter. Underline that. Okay, patient care. Patient care we know is very important. You're going to interact with patients, take vital signs, administer medications. Workplace and patient surroundings should underline this. Always be sanitized as bacteria flourishes in hot and damp areas and can cause health problems. Question may be bacteria. Where does it grow best? In hot and damp areas. So when y'all get to these and stars and underlines and y'all get to make your flashcards or questions for practice, just always turn it around and ask a different question of what is there. You already know at the end of that next paragraph, you got to be friendly, well-spoken, and well-mannered. And that is to your coworkers, doctors, patients. So I don't care if you had that bad day. Don't go in there acting like you had a bad day. Throwing stuff and acting, You go in there, and that's what I can't do. That's why I'm a floor nurse. We can act a little up, but in an office you don't act like that. You pretend you like everybody in there. You talk to them. You say hello. You speak. You don't. I'm the person that if I don't like you, we're not really, we're not even cohabitating together too long, or sitting together. But but that is not how you act in an office. In the office, you are, whether you like them or not, you are put that smile, you agree with them, or you disagree on a very lovely level. That's how you do things in office setting. Make sure any procedure performed, such as taking vitals or doing phlebotomy or taking urine, make sure it is fully explained. Always explain what you're going to do to that patient before you do anything to them. Let me know. Even if it's not a full explanation, you need to say, I'm about to take your blood, I'm going to do this, you're okay. Sometimes you have to get consent, especially if you're going to stick somebody. It's okay to stick you. A lot of times you don't get that just straight out consent. They stick their arm out. That's consent enough for me. That means, yeah, she's ready. But legally, we're supposed to ask for consent. Will you accept I've got to pull your blood today? And they say, okay, that's consent. But yeah, that to me is consent. But make sure that is done, and make sure you explain what you're gonna do. Always explain. Now, y'all should have some medical background being in this class coming in. vital signs. You should already know vital signs. You should already know your vital sign parameters. If you do not, I need to get with you and we need to get there. Because that is the number one thing. You'll probably be accepting that patient. Hey, how are you doing? What's going on? You know, the doctors with the other patients. Let me get your weight. Let me get your blood pressure. Let me get your height. Let me, whatever, wherever you're at, they do different things. But blood pressure and vital signs is number one. And then once you write all that down, you ask them, okay, what made you come see the doctor today? You write the complaints down. Okay, you know, okay, the doctor will be with you in a minute. You put the little chart in the door, and you know, go get the next patient. You're kind of get ready for the doctor kind of person. So just know that will come into play. But you need to know all that. If you do not know, we will have a vital sign test that you got to make 100 on, and I will give you that piece of paper that I have not gave y'all yet. Find that. I will find it. That's another thing. Even your phlebotomy, then they need to know blood pressure parameters, vital signs, your heart, respiration, temperature, and blood pressures. Sometimes, most of the time, CMA is going to do that. Sometimes phlebotomies.
When I go to the they check all that.
Yeah.
Your blood pressure.
Oh yeah, all your vital signs. That's CMA, and normally it is a CMA that's bringing you in. If it's not a nurse, it's a CMA. So it's gonna be one of y'all, or the nurse might do it, and then they send you to the CMA to draw your blood. So that's the CMA can actually add primary care in Thomasville. The CMA is drawing blood right now. So, you know, I look at all that. What's your title? But there is the CMA. Things like that. Just keep that in mind that you're going to need to know that. If not, we are going to shortly go over that. But this is also something you should already know. My CNA should know this. I always fuss. Who's a previous CNA? I know you're Brundy. Anybody else a previous CNA? How is your health care? What is your history? Okay.
I used to work at hospital in transport.
That's what you need to say. I need some medical background. You're gonna have to do a little more background work for real.
Okay.
If you don't have it, we got to pull you in a little bit more.
Okay.
Because in order to be in this class, that's what you're supposed to have to take the 6-week course. You already have some medical background, you already worked in it, you already sit patients, you already,
I did.
okay, sit with patients, that works.
Okay.
When they ask you, that's what goes on the application. Okay, don't say you don't, you did.
Okay.
What's your,
I'm a tech currently, instrument tech.
there you go. Instrument tech, you sanitize, okay, so she knows about that sterilization. Okay, that's a good job too, it's actually a good job. You haven't done a lot of patient interference.
I actually do,
You do?
and she lets me help a lot with
Oh, okay.
things, so.
Okay. Well, just being in healthcare, and you get some of the laws, you get some of the things you cannot do, you can't, all that. The vital signs I gotta get with y'all.
Yeah.
And Bernie, you should know your vital sign. If you don't, we're gonna go over them, and we're just gonna take that day. Phlebotomy.
I learned how to do it when I was working at one word.
Okay.
Well,
Yes.
we just, like at our office, we just have the digital, so that's like I want to learn.
Yeah.
For the pump.
Oh yeah, because one day them pumps are not gonna work. The electric ones are not gonna work, and you're gonna be like, uh-oh. Or you're gonna be down the hall, and somebody else has got that one that does work,
Yeah.
and you're gonna need some vital signs down here. And you know, just know that will happen. That's fine. And if you do get a bad measurement, I don't want the bad measurement. I do, but I'm gonna tell you, take a manual one. Go ahead and take a manual one before you come and report that to me, because it may be that the blood pressure machine just wasn't reading accurately. Sometimes it happens. That manual will tell you exactly what your blood pressure is, no matter what. So just know that is your background that you need to get in your head or get back in your head. And it actually is what you would have learned if you sit with patients, if you CNA. any of that kind of stuff will bring you to how to take care of a bedridden patient, because you still might have to do that. You still might, depends on where you're working at. That you still need to do this, at least to make a patient feel more comfortable. You may just be coming in to draw some blood, but let me rearrange your pillow. Where's your air ring? Something. If a patient's complaining to you, let me tell somebody else is not always the best answer, because that's not my job. That is never the answer. Let me see if I can do this, and then I'll call your nurse. But try to do something to appease your patient. Even though you're just coming in to visit to draw blood, do a little something. But always let them know you'll tell the nurse. But just rearrange something. Just make them feel better. Sometimes all they want to say is all you can say is I'll have to tell the nurse. But it really just depends on what they're requesting. But try to do something, make them feel just a little better. You want some ice? Can I give you some ice? Then I'll let the doctor know. Or just something to make them feel a little better. And sometimes you don't have time to do all that. So just know your job, and you'll get to know your job. But you should know these history, as a history kind of thing. Support should be provided for back and joints in order to prevent strain. So, to prevent strain, we need to support the back and joints. Go back and forth with it. Make you some flashcards or make you some pretend questions when you go back through that. Arms and legs should be in a comfortable position. We call it anatomical. If you can get it in an anatomical position, that's the way it should be. That it should appease most people if the other ways are upsetting or hurts them. Underline this as well during bed changes. Communication with the patient is important. Don't just, and this is with your phlebotomy, with your urine, don't just not say nothing. Talk to your patient like there's somebody, because that's your person for the day. Eventually, you're gonna start talking to your patients whether you do or don't, because that's the only person you got to talk to at the moment. You ain't talking to nobody else all day. I guess I talk to my patients. Tell them, because your patients will start talking to you. But be cordial, nice, friendly. Underline all three of these. These are all important. You will see them again up under it says other considerations. Offer pillows for support, such as a patient that's uncomfortable laying on their side. So offer pillows for support. Use a bed cradle. Y'all remember what a bed cradle is? It's just a little thing at the end of the bed that actually, it's kind of like the tents we used to make back in the days. You put a little tent up, but it's a tent for the feet, for the bottom part of the legs. It keeps upper beds off the patients. Some people have pain just with the slightest things on their feet, and you don't want to do that. Some people will get that foot drop, get those covers off of their feet.